Good morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning.
Good morning.
It's Friday, and it's our COVID Friday.
I don't know if we should brand it like that necessarily.
You don't think so? Okay.
No.
But this is the week that we do our COVID program.
That's right.
Dedicated to local information about COVID-19.
That's
so
right.
We're excited about that. Look at the guests we have lined up for today.
That is a powerhouse.
That? Right?
Yeah.
Look at that. Our two favorite doctors.
Correct.
In the region.
Erin Philpott and Greenberg.
In the Western Hemisphere.
That's right.
Yes.
The Western.
They're going to be with us. And our other favorite person, Devin Neeley.
Quality. From the county.
From San Juan County.
Yes.
Exactly. Giving us an update on COVID. And so we're looking forward to that.
Yes.
So that's exciting. So we thank them for joining us here in the next few moments. But in the meantime, we'll talk a little bit about some of the things that are going on as we wait for
Let's do that.
our guests to call in, right? And so vaccinations are still happening throughout the community, of course. And let me show what I really want to show, which is this. Later on today, here at San Juan College at the HHPC, there is the COVID-19 vaccination event with Pfizer. So first, second, and third doses, right?
Right.
9 to 10:30 today over at the HHPC.
Over at the gym.
Yes. So that's going through. And again, it's for folks who are, again, for boosters for the immunocompromised, 65 years of age or older, 18 years or older with medical conditions, or 18 years or older who are deemed essential workers.
Great.
And so they're available to do that. You can reserve your dose again at vaccinenm.org. And of course, there are a lot of other places you can get a COVID vaccine throughout the community.
Mm-hmm.
A lot of pharmacies are offering them. A lot of Walmart's offering them, I think, still. Sam's Club, all those places, right?
Right. So just go to vaccinenm.org to reserve your spot, and you can delineate where you want to go.
Yeah,
there.
You could choose your location, right?
Right.
Yeah, so that's cool. And then we're learning more about, I think, there's conversations nationally about more boosters coming out for the other
just approved
doses, right?
Did you hear that? FDA has approved Moderna and Johnson & Johnson.
Okay. And I think they're even allowing you to maybe mix and match, aren't they? That you have more options because they think that that's working. And then I think soon, and we'll talk to the doctors about this a little bit later, vaccines for younger kids, ages 5 to 11. I think that's the next thing coming out too, right?
That's right.
So we'll talk more about that in just a moment. Other things, the weekly COVID cases that we're pulling from the State Health Department for San Juan County. This is local information. The San Juan County epidemic curve. And I remember last time we did the show, we were kind of trending up.
That's right.
And now we're trending down.
Which is great.
Which is good.
Good news on this Friday.
Cases are high, but they're not as high as they used to be.
Right.
Which I think is maybe the hope that things will continue to trend downward. But I know folks are worried with the advent of winter weather that folks will be more inside, and that tends to have more spread.
Increases,
and problems.
Risk of transmission. Well, and I believe it was Matt Beaver that said that we focus on the trends, not the daily cases as much. So obviously daily cases lead to trends, but seeing a decrease in case and that line, that orange line, is key.
Right. And that's why I like to show this graph, because it is showing that 7-day rolling average and not just the daily ups and downs.
Right.
And so we're hopeful that will continue to go in that downward direction.
Right.
For San Juan County. And so there you go. COVID testing still happening, of course, in the community. And so we always want to remind everybody, we start with Aztec Schools. They have their COVID testing site open every Wednesday and Friday. So today, already opened at 7 a.m. until 3 p.m. And again, on Wednesdays from 7 to 3, Fred Cook Stadium over in Aztec. So there's that option if you need to go get tested for free. McGee Park, of course, they've been open forever.
Yeah, they really have.
With COVID testing, right?
Thank God for the folks at McGee Park.
Yeah. And so that is, again, Monday through Friday, 8 to 3. So, again, that's kind of been the go-to place to go get tested. Farmington Schools on 30th Street, they are doing their tests on Monday, Tuesdays, and Thursdays for COVID testing as well.
Right.
So that's available over there. So there you go. And I know you get tested. You're still getting tested pretty regularly for your job?
No, I'm triple vaxxed, so
Are you now?
we don't get tested unless we have an exposure or symptoms.
I gotcha.
People who have not been vaccinated get tested every Monday.
That's true. Okay, understood. Yeah. And others may need to be tested on a more regular basis as well. So there you go. Our first guest is called in.
Yes, let's go to the phones.
Are we ready to talk to Devin Neeley from San Juan County? Mr. Neeley, good morning. Thank you for calling in this morning.
Good morning, Mr. Michlin and Ms. Cullip. Thank you so much for having me again. Good to hear you all.
Well, nice to hear you as well. And we wanted to talk to you because this week there was an announcement about an outbreak of COVID cases at the San Juan County Detention Center. And so we wanted to kind of bring someone from the county on, and you've graciously agreed to come on with some updated numbers to tell us just what the situation is at the detention center. So what's the latest that you have for us this morning?
Yeah, certainly. Well, as of this morning, we're running a population just under 500. We have 498 detainees in custody this morning, and of those, we're showing 134 positive with COVID-19. There are another 105 in the facility that have recovered. They have contracted, tested positive, and met the 10-day requirement to be considered recovered from COVID-19. And then I have another 113 under observation. And let me look at my numbers here. I believe it's this weekend we'll be able to review another 103 of the current positives and clear them as recovered. So the number is going down, but once we reach that threshold above about 100 positive detainees in the facility, we felt like it was the right thing to do to inform the community for a couple of reasons. First and foremost, people have their friends and loved ones in the detention center for one reason or another, and they're worried about them, and we want to be very transparent with what's going on at the detention center. And the other part of this is we have noticed that an increase in the detention center does also mirror an increase in our community. So we would encourage people to be extra vigilant. If you're not vaccinated and you've spoken to your doctor and you and your doctor make the decision that it's right for you, we would hope that you would be vaccinated, and those vaccinated or not are following the state and federal orders to wear a mask when appropriate and work together to curb the spread of infection across our community.
Very good. And do you know about COVID precautions that are taken at the detention center? Are detainees always wearing masks? I guess staff probably are too. Are we extra cautious when we're cleaning there these days? Do you know about that stuff?
Yeah, and honestly, it starts as a detainee with a law enforcement officer enters the facility. There's a screening before we even have an officer bringing a detainee in the sally port. They check for fever. Upon admission into the facility, each detainee is tested, and then they'll be placed in holding according to their test results. If someone tests negative, we're going to keep them with other negative detainees. If somebody tests positive, we're going to keep them with other positive detainees. And that's just the very basis of how detainees are entering the facility. The San Juan County Adult Detention Center falls under the guidance of the public health order, which currently requires masks for all individuals regardless of vaccination status, and that includes in the facility. We provide masks to those detainees, and they're required to wear them just like the rest of us are when we're out and about in our daily lives. Additionally, we're providing cleaning supplies and sanitation supplies, and the pods are cleaned regularly to do all we can to reduce the spread within the facility.
Gotcha. And Devin, again, you mentioned that cases are trending downward. Have any of your detention center inmates had to go to the hospital, had to be hospitalized because of their COVID symptoms?
No, so far our medical staff, we work with a contract provider called WellPass, and the contract provider takes really good care and keeps an eye on everybody that is testing positive within the facility. And should additional care be required, we within the last year, we've had a few detainees who've had to be transferred out for additional care, but right now I don't believe that any of our detainees have been transferred to the hospital for more acute care than what's provided at the facility. And so that leads me to believe, and I don't have any reason to think other than these are relatively mild cases. Every infection of COVID-19 is quite serious. However, in the scale of cases, there are more relative mild cases, and that seems to be the strain that is up at the facility right now.
Very good. Well, Devin Neeley, it is always a joy to have you guys on with the county. Thanks for all your hard work. Thanks for working with us throughout this time, these times that we're in. So thanks for calling in.
Certainly, and thank you all for your time.
Thanks very much. Joining us now to talk a little bit about recent conditions at the hospital at San Juan Regional Medical Center. We're always thrilled to talk to our two favorite doctors in the Four Corners, Dr. Erin Philpott, Dr. Brad Greenberg from San Juan Regional Medical Center. They are on the phone with me today. And doctors, good day. Thank you for joining me. Always appreciate your time. I know how valuable it is.
Good day, Scott. Thanks for having us.
You bet, Dr. Philpott. Thank you, Dr. Greenberg. Earlier this week, New Mexico, the state, adopted this crisis standards of care, and so I kind of want to spend some time with both of you to talk a little bit about what that means for both of you and at San Juan Regional Medical Center. It puts into place certain policies, I guess, because of the increase in COVID-positive patients. Is that where we are? Dr. Greenberg, let's start with you.
Sure. So indeed, the state did make a declaration that didn't provide for automatic crisis standards of care in every hospital, but it allows hospitals to apply for crisis standards of care. And they really haven't delineated exactly how that application process is supposed to work. So we are currently not at crisis standards of care. But crisis standards of care is defined as a substantial change in usual healthcare operations and level of care that a hospital or facility may be able to deliver. And usually it's necessary because of a pervasive and catastrophic event. And in this case, the significant prolonged surge of patients as a product of the pandemic, specifically this wave associated with the Delta variant. So crisis standards of care must be declared by a state government, and there are certain kinds of legal and regulatory powers that are associated with it. So what that means at our facility is that we try to, over time, we've adapted, right? So the last 22 months, we've gone through what you could call conventional approaches, through contingency approaches to expand our capacity, improve the care that we're providing, and then finally into more crisis capacity where we have real challenges with space, staff, and supplies. And those challenges sometimes make it impossible for us to continue the usual way we do things, the usual standard of care. So we have lots of these challenges, but we've been existing in this continuum, and San Juan Regional Medical Center has done a whole range of things to try and improve how we care for these large numbers of patients and these very, very sick patients over time. But we know that this declaration, it changes the way that the hospitals further operate, and it changes the legal environment, and it changes expectations of the public. And one of the things that I think does describe the difference between where we are with contingency level of care and crisis care is the establishment of triage boards, which are groups of physicians where you have those folks that are very critically ill, and if you have, this is the nature of the challenge that we have. We have multiple people who may require scarce resources, and so we try to, if we have to engage crisis standards of care, which we have not, we have to use these boards to help rationally allocate the scarce resources in order to do the greatest good for the greatest number. That's the super big challenge associated with crisis standards of care. The other one is that we are always, whenever you go into crisis standards of care, your number one goal is to get out of it. Your number one goal is to get back onto conventional footing. And so we remain very much interested in the ongoing efforts with preparedness, looking at things to substitute, adaptation, any kind of conservation or reallocation within the organization to get out of these challenging times. But this is where we are. This is there's no beating around the bush here. We have too many sick people in our community than the hospital. Our community's percent positivity rate is 16.75% as reported by the state, and our percent positivity rate is right around 17% as well. We have roughly 90 cases per 100,000. That is an astronomically high amount of disease that exists in our community. This morning we had 65 COVID-positive inpatients in our facility. We have fully occupied ICUs where we're both our normal ICU and our contingency ICU are fully occupied. We have a very large number of intermediate care patients within the facility. So this pandemic it's not just that it hasn't gone away. We have a real crisis within our own healthcare infrastructure in our community. And we are doing our part to make sure that we make the right kinds of choices, the right kinds of resource allocation. But I would implore every single listener that if they have not been vaccinated, they need to get vaccinated now. They really should consider that. And they need to consider wearing that mask, doing the social distancing, and washing their hands in order to reduce the disease burden in the community. Because it's not just the COVID patients right now that are at risk. All patients, regardless of COVID or not COVID, are at risk of when we have these scarce resources. We need those folks that are, those folks that have other illnesses that require significant amounts of medical care. We do not and will not. There's no allocation based upon COVID or not COVID. It doesn't matter if you're vaccinated or not vaccinated. It just matters, how likely you are to benefit from the services that we have to offer. And it is very important that everyone does their part to try to reduce the burden on our local healthcare infrastructure. I could, with that, Dr. Philpott, anything else to add to that?
I think that was a pretty comprehensive explanation. I think one thing to point out here, as Dr. Greenberg alluded to, is we have a significant number of non-COVID patients, and related to ramifications from not seeing their primary care physicians over the last year, some services on pause. So, for example, screening colonoscopies, people now being found with more advanced cancers that were easily treatable early on. Additionally, mental health issues with depression and suicide attempts. So a lot of sort of additional repercussions from the pandemic and the lack of health care over the last year. So really for those folks as well, to keep seeing your primary care doctors, keep filling your insulin, keep taking your blood pressure medicine, take care of yourselves, so we can kind of all work together to get through this. Dr. Grace had presented in the press conference a couple of days ago that there were, I believe, 11 ICU beds across the state open kind of the morning of the statistics, and they would likely be filled before noon. So it is, as Dr. Greenberg said, pervasive throughout the state. Everywhere is experiencing similar circumstances, or is experiencing similar circumstances. We're having severe nursing shortages. Nurses are going to other states to travel and earn higher wages, of course, and everyone is just exhausted. So a really difficult time, and we're all doing our best to provide the best possible care.
And thank you both. And those numbers seem really, really high to me. And we were talking before we came on the air that they are high, and show no signs of abating at the moment, at least at the time. And Dr. Greenberg, from the numbers that you mentioned about COVID patients, I mean, again, I know the hospital keeps track of whether they're vaccinated or unvaccinated, and I still think we're seeing the majority of folks who are hospitalized are unvaccinated with COVID infections, are they not?
That's absolutely correct, Scott. And so just the numbers really are that 81% of all of our hospital inpatients, and even a much higher number of those folks that require critical care or have died, but 81% are unvaccinated. So we really do believe that the bulk of these hospital admissions and this excess demand is preventable if folks were to go get vaccinated. And I do want to comment, there is a myth out there that where the governor's vaccine mandate caused the nursing shortage. Well, that is fundamentally untrue. We have our nurses and our nursing shortage predated the pandemic. But we have had challenges with folks that have decided to travel and whatnot. But the total number of folks that have left the organization, and this is nurses and not nurses, is less than a dozen. And we've set up structures for exemptions, and the vast majority of folks did get vaccinated. So the governor did not cause a nursing shortage. The nursing shortage was here all along, and it's been exacerbated at our facility, like every other facility in the country, by the changes in the healthcare worker market. But back to your point that you're saying, Scott, is that, yeah, we are really worried that we are not done with the rise in cases yet. Very, very concerned about the disease prevalence in our community and the impact to our organization. And this is a little bit different than before. We have real challenges in front of us, and our rate of rise and our experiences up here in San Juan County, it looks a little bit different than what's happening in the rest of New Mexico that seems to have leveled off. So we've got some considerable challenges when most of the resources within the state of New Mexico have already been saturated.
Well, that doesn't sound like good news with winter approaching, Dr. Greenberg, but I know it is what it is, and you really can't change it, and that's what we are seeing. Dr. Philpott, for your perspective, does this mean that some elective surgeries are being postponed or canceled just because of being so close to implementing maybe these crisis standards of care, even though they're not in effect yet at San Juan Regional Medical Center? It sounds like we may be close to that happening, depending on how things go over the next few days or weeks.
Yeah, great question, Scott. I think that's an important question everyone's asking, especially patients anticipating surgeries and surgeons providing them. We as a facility generally don't do truly elective cases. There's a pretty significant amount of discretion written into this new order that even that basically the surgeon doing the surgery is allowed the discretion to determine whether or not it's necessary to do. So I think we learned a lot from the first couple waves and sort of the statewide mandate to shut down electives or significantly reduce surgeries at different facilities or seemingly elective procedures. As I was mentioning, we're seeing all these negative outcomes of things that we push pause on. So I think there's real recognition at the state level that wasn't the right move, and so we're kind of moving along as we reallocate and allocate our resources within our hospital and making sort of thoughtful decisions of what volume to proceed with when.
Understood. And Dr. Greenberg, I know a lot of folks are kind of holding their breath because with winter coming, more folks may be gathering indoors, and indoors is not a good place if you want to stop the spread of this COVID-19 infection. And so you've already mentioned about wearing masks and washing hands, and that just needs to go without saying, does it not, as we get into the colder weather here?
Absolutely, Scott. And you know, I did want to say, just to add one other point about the electives, is that you know, the organization already doesn't do truly elective procedures, and so if you need the procedure, and your surgeon will make sure that it gets done. And I think that is a really important thing to know, is that all of the procedures that are most strongly considered for potential delay are those that may require inpatient stays, but they're considered by some folks that are very well informed, and the surgeons themselves. And so I think that to echo what Dr. Philpott said, do not delay your care. Get the care that you need. And, you know, our organization and the state has recognized that care, COVID or not COVID, is super important. Now, to go back to what you were saying, Scott, like I can't agree more right now. I mean, the most important thing about what's happening with winter coming is if you are eligible for a vaccine, go get vaccinated. and really become informed about vaccination. Make sure that you understand the facts and the science behind the vaccine. Avoid the politicization of vaccination, and please listen to and make decisions based upon the science and what's good for your health and the health of the community. I do think that people need to exercise really good judgment and make good choices when it comes to gathering with others, especially if there are unvaccinated persons as well. And absolutely agree with the governor's ongoing mask mandate for indoor spaces. And please, please, please wash your hands and appropriately socially distance when possible. The hospital and our organization will do our best to be there for you. But I need each and every person out there to take some degree of responsibility for their own actions to try to help the hospital out too.
Well, that's a good point, and I thank you for sharing that, Dr. Greenberg. We just have a couple of minutes remaining this morning with both of you. Real quick, Dr. Philpott, maybe just looking ahead as the vaccines, of course, are out. The boosters are rolling out. We're talking maybe about vaccines for younger kids, maybe 5 through 11. All those things sound like, within the next month, I would say, will soon be approved for children. And things along that line. Your advice, again, for folks to investigate and, if they have to make a choice about having their child vaccinated, can you give us any advice about that?
Yeah, I think, a few things. I think, being a hospitalist and admitting a number of people to the hospital with COVID who have not been vaccinated, as Dr. Greenberg said, our numbers around 81% are unvaccinated. I believe we've only had 3 deaths of people who have been vaccinated, and that is kind of in line, or actually even maybe a little bit higher than sort of more the nationwide statistics. The vaccine really decreases your odds of death substantially. You are 10 times less likely to die from COVID if you've had, 11 times less likely to die of COVID if you have had the vaccine, and 10 times less likely to get severe COVID. So I think that is very compelling. We do not have good, effective therapeutics once you reach hospitalization or are in need of hospitalization, and I cannot emphasize that enough. We have very little we can do once people are severely ill other than really supportive care with our steroids, remdesivir, some immune-modulating medicines. So the vaccine truly is the answer. We're seeing a lot more cases up in Colorado, especially among kids, and a lot of states with kids going back to school. So this is a huge age group that is being impacted by COVID. So I think really increasing the uptake and getting our little people vaccinated is going to substantially help us as we go through the winter months. There's been a number of hospitalizations among children, so I think that risk-benefit ratio is really in the favor of getting our children vaccinated as well. I think, of course, we all know and have heard about the unfortunate passing of Colin Powell, and he was vaccinated. I think it's important for the public to recognize that even he also had multiple myeloma and was getting treated for that. So it is not 100% effective at preventing death, but they are very, very effective and very, very safe. So I think that, I strongly encourage, of course, everyone to kind of pursue that for both themselves and their kids when it becomes available, and then also the booster doses when they're available to the certain groups.
Sure. And just, and General Powell was, 85 years old as well, and certainly we know how the elderly are more impacted from COVID infections than maybe a younger person might be, even so.
Exactly.
So thank you for that. Dr. Greenberg, just final thoughts this morning about the vaccines, and again, if you're eligible for a booster, should folks be thinking about that or signing up for that? And again, I think we have the infrastructure here that anyone who needs a vaccine certainly can get a vaccine. If you're part of those groups that are eligible for a booster, I think you can get those too. And then when they roll out for kids, that will also be added to the infrastructure. But it seems like we have a pretty good system here in San Juan County to get shots in arms, don't we?
Absolutely, Scott. And we've got local pharmacies, a number of the different providers' offices are also providing it, and I think also the Department of Health does have some options as well. So I would strongly encourage folks that are eligible for a booster to consider one. And anyone who has not been vaccinated, please, for yourself, for your family, and for your community, go get vaccinated. So the best time to get vaccinated was probably about 2 weeks ago, but today is fine too. And please get vaccinated.
There you go. Well, again, both of you, we really appreciate your time this morning. Thank you so much. Dr. Erin Philpott, Dr. Brad Greenberg from San Juan Regional Medical Center, and I know you both would, I think, tell folks to go get flu shots too. It is that time of year as well, right?
Yeah.
Absolutely.
All right. Very good. You both, please take care and give our best to your colleagues there at the hospital and all the folks who are working long hours to see us through this pandemic. Thank you very much, both of you.
Thanks so much, Scott. Have a great day.
Thank you.
And there you go. San Juan Regional Medical Center, our doctors, Erin Philpott and Dr. Brad Greenberg.
Always.
You missed it. You missed it. When we
that
spoke.
Was a sad
just a day ago. I know.
I was very sad to miss it.
You had other commitments that you couldn't be part of that interview, so it's okay. We missed you too.
Thank you.
They mentioned it. I edited that out. You're welcome.
Of course you did.
Yes.
Because you're still mad about our other show,
which is next week.
Is next week.
That's right.
Solutions from the Street, solutions-focused journalism. We take a problem, and then we interview somebody who's a solution maker doing something about that problem. And next week is going to be really interesting.
Yeah, it's about dentistry.
Well, sort of. Yes, dental anxiety.
Okay.
So,
see, that was the tease. That was just to get people thinking about dentistry.
Like
what
could
the problem
be going?
Right.
Yes.
But now you've given it. That's okay.
Sorry.
It's okay. Dental anxiety, I think, still will get people to tune in.
It's a lot of people feel it, at least on, there's a spectrum, at least on some level. A lot of people feel that, and we'll learn more about the hazards of, when we're feeling that, what that does, and how a lot of people just don't go to the dentist at all because they're anxious about it. So
right, which isn't probably a good thing.
It's a bad thing for your teeth.
Yeah, so there you go. All right, that is next week, everybody. Solutions from the Street with Megan Cullup and Scott Michlin.
There you go.
Because you get top billing.
I get top billing.
I don't know how that happened.
I don't know. We're still wondering.
We are. Okay. But anyway, that's it for our COVID program this week. Thank you for joining us, everybody. Until next week, be well and stay safe, and we'll see you next week here on KSJE. Bye-bye.